So hello everyone, I hope you're all doing well. So welcome back to my YouTube channel. So in this video, in this episode, I'll be covering about the treatment of acute renal failure, as I already told you in my previous video about the renal failure. So there's some treatment protocols you should follow if you have acute renal failure. So basically, the goals of treatment is to minimize the degree of kidney insult, reduced extra renal complication, restoration of the renal function to pre-acute kidney injury is the ultimate goal. So what are the treatment approaches? Basically, there's no definite therapy for acute renal failure. Sportive care is the mainstay of the management regardless of the etiology. So treatment of acute renal failure, basically sportive care is the mainstay in the treatment of the acute renal failure. Sportive care include adequate nutrition, correction of the electrolytes, acid-base abnormalities, particularly hyperkalemia and the metabolic acidosis, fluid management, correction of any hematological abnormalities, medical management of infections, cardiovascular or GI conditions, and respiratory failure. All the drugs should be reviewed and dosage adjustment made based on an estimate of the patient's GFR, glomerular filtration rate. So the treatment of acute renal failure, that is non-pharmacological. It means you not need any medication for this treatment. So those treatment is called non-pharmacological treatment. So maintenance of adequate cardiac output and blood pressure. You need to be check your blood pressure at regular interval of time. You need to discontinue the medication that diminish the renal blood flow. You need appropriate fluid and electrolyte balance. You need a replacement therapy, that is hemodialysis or peritoneal dialysis. You need absolute indication of for dialysis, that is include blood urine nitrogen greater than 100 milligram per deciliter, potassium greater than 6 milli/L, magnesium greater than 9.7 milligram per deciliter, metabolic acidosis with pH less than 7.15, and diuretic resistance fluid overload. So we can treatment of acute renal failure. So pharmacological therapy, as you know, loop diuretics, thiazide diuretics, mannitol, that is mainly mannitol is used in the children's if you have any kidney related issues. So loop diuretics are effective to reduce fluid and overload. It can worsen the condition as well. Thiazide diuretics used as a single agents are generally not effective for the fluid removal. Mannitol, potassium sparing diuretics, low dose dopamine is not indicated in the treatment of acute renal failure. Although some diuretics are used, that is mostly loop diuretics, furosemides like diuretics, Lasix. So treatment of acute renal failure, pharmacological therapy, equipotent dose of loop diuretics like furosemide, torsemide, ethaclinic acid. Ethaclinic acid is reserved for sulfur-allergic patients mostly. Continuous infusion of loop diuretics, furosemide, butamide, torsemide overcome the diuretic resistance. Dose, initial IV dose equivalent to 40 to 60 milligram furosemides, continuous infusion equivalent to 10 to 20 milligram per hour. Treatment of acute renal failure. Strategy to overcome diuretic resistance, administration of the agents from different pharmacological classes that act synergistically. It means we can use different drugs from the different classes, but they act like same. Like thiazide or loop diuretics works on distal columnar tubules and ascending loop of Henle. They work synergistically. Treatment of acute renal failure, electrolyte management. You need to management the electrolyte. Electrolyte should be monitored regularly, daily. Hyperkalemia is the most common and serious electrolyte abnormality in the acute renal failure. So basically what would happen when kidney does not able to clear or filter the blood, and it can excrete a lot of sodium but does not excrete the potassium, then that potassium cause hyperkalemia and mostly related to cramps or arrhythmias. Okay, so hyponatremia and fluid retention commonly occurs, require daily calculation of sodium intake. Phosphorus and magnesium should be monitored. So how we can prevent the acute renal failure? The best prevention measure of acute kidney infection, especially in individuals that are at high rate, is to avoid medications that are known to precipitate acute kidney infection. Nephrotoxicity is a significant side effect of aminoglycoside, ACE inhibitors, angiotensin receptor blockers, amphotericin B, NSAIDs, cyclosporins, tacrolimus, radiographic contrast agents, GFR less than 60 ml per minute, diabetes patient, dehydration patient more than age 65 years. So these are the things that mostly constitute the nephrotoxicity. So how we can manage the acute renal failure? So management includes hemodialysis, peritoneal dialysis, medical treatment, non-medical treatment, as I already told you, electrolyte maintenance, dialysis or IV dopamine, diuretics, hemodialysis, they need to be done. Road replacement therapy, nursing interventions. In acute renal failure, you need to monitor 24-hour urine volume to follow the clinical course of the disease. Monitor the blood urine nitrogen, creatinine and electrolyte. Monitor the arterial blood gas levels as necessary to evaluate the acid-base balance. Weight the patient to provide an index of the fluid balance. Measure the blood pressure at various times during the day with the patient in spine, sitting or standing position. Adjust the fluid intake to avoid the volume overload. Watch for cardiac dysarrhythmias and heart failure from hyperkalemia, electrolyte imbalance or fluid overload. So these are the interventions that mostly person can do, nursing person can do basically. Urinary tract infections, you need to be watched. In acute renal failure, what is the role of pharmacist? We pharmacist, as recommended for renal drug adjustment, we can adjust the dose of the drug for the renal patients. We can cost avoidance secondary to these interventions has been well described. Pharmacists are an important member of the healthcare team and are appropriately trained to make the rational drug dose. Rational drug dose, what does this mean? Right patient, right dose, right patient, right drug, right dose, right route, right interval. This is called rational drug dose adjustment in the patient with acute renal failure. So what is chronic renal failure? Chronic renal failure is basically progressively or irreversibly loss of the renal function over the time when there is a decline of the GFR and the creatinine clearance, and they lead to the end stage renal disease. So how we can calculate the creatinine clearance is by formula 140 minus age in years multiplied by body weight in kilogram over 72 multiplied by serum creatinine in milligram per deciliter. And what is end stage renal disease? In end stage renal disease, there is irreversible loss of the renal function when the patient accepts that its renal function has to be dead and he needs renal replacement therapy in order to avoid the life-threatening infections. That is uremia basically. Uremia, what is uremia? Is basically laboratory or clinical syndromes that is due to the dysfunction of all the organ system or acute or renal failure. So these are the stages of the renal failure. Stage 1 is a kidney damage with normal or increased GFR. Mostly the person that has a normal kidney, his GFR should be greater than 90 ml per minute. So the person that has GFR 60 to 90, that is mild reduction GFR, that is constitute the stage 2. So the person that has GFR 30 to 60, moderate reduction in GFR, that constitute the stage 3. And in stage 4, that is severe reduction in GFR, that is less than 15 to 30 ml per minute. And in the last stage, that is stage 5, you are associated with a kidney failure that has GFR less than 15. So normal person has GFR basically greater than 90 ml per minute. That is good. So in the next video, we can discuss about the common causes of chronic renal failure that is associated with diabetes or glomerulonephritis or blood pressure. So I hope you can learn those things very good, or if you have any query, let me inform in the comment section.